And just, sorry, we forgot to say that meeting is being recorded as well. So those who are not able to join can hear that later. So a lot of work over the years around mainstreaming protection, ensuring that we're not doing harm, but are also looking at how other sectors delivering services are either increasing or decreasing protection risks. We have many programs that embed protection. So examples from child protection, you might visit a food distribution site and see a child protection person there registering unaccompanied separated children, for example. A long time ago, I did my child protection social work training in a hospital. It was very much seen as, and was, part of the health response, protecting children from violence and abuse, for example. Monitoring and reporting of rights violations. We talk about, for example, attacks on schools and hospitals and how we work together on such areas. So a whole range of ways in which we can work together. And of course, ensuring that protection is central is very much based on the idea that we do analysis together. So we formulate the protection picture, understanding both the location and the types of issues by taking information from other sectors to understand the situation, to advocate together, and to formulate integrated response. So now more than ever, it's important that we work together in those ways that I've just mentioned and many more. As I said, with COVID-19, we're seeing those impacts. For example, food insecurity, but also the way in which quarantine is being set up, for example, has direct implications for people's protection, the way that lockdowns are put in place, for example. So I'm going to stop there with those introductory remarks, and I'm going to take us through the different presentations briefly. I mentioned we're going to be hearing from donors, from cluster coordinators, country and global level, agencies as well, and hear a bit about some of the work that has been going on to connect the different sectors. And we're going to start with Charles Apotheker from Swiss Development Corporation, and to hear his perspective as a donor, what they've been supporting, their views, and where we need to be moving. So with that, Charles, over to you. Just also, as we're shifting, as Yasmin said, if you've got a question, please don't wait until we get to the plenary. Do use the chat box so we can collect those and distribute them when we get to the question and answer. Charles, over to you.
Yep, thank you, Michael. Hi, everyone. Apologies in advance because I won't be able to use my camera today. But thank you for your participation, and thank you to the Global Protection Cluster for inviting SDC to be part of this afternoon session. I'd like to start by saying a few words on some of the interlinkages between protection and food security and protection and health. So first, on protection and food security. Indeed, when agricultural livelihoods are destroyed and access to food and water is no longer given, families might resort to negative coping mechanisms, such as early marriage, child labor, and withdrawing children from school. Therefore, food insecurity as a consequence of conflict, natural disasters, lack of governance, or a combination of these factors is a serious driver of protection risks and poses especially high risks for children. The ongoing socioeconomic decline and looming food crisis resulting from COVID only aggravate these protection risks for children and provide us with yet another example of how closely interrelated child protection and food security issues are. In the same logic, the interplay between health and protection is multifaceted. Although IHL requires specific protection for health workers, facilities, and transport, recent conflicts show flagrant violations of IHL provisions pertaining to healthcare. Areas where the health and protection sectors intersect include, for example, efforts to ensure safe, dignified, and equitable access to healthcare, protect the unique needs of vulnerable and stigmatized individuals and groups. Or another example would be mental health and psychosocial interventions, which also contribute to protecting the dignity of survivors and enhance the quality of the overall humanitarian response. As a result of these connections, of these interlinkages, we've seen increased engagement between the protection and health clusters at global and field levels to systematically strengthen their collaboration. Let me now just say a few brief words on SDC humanitarian aid engagement with protection. As many of you would probably be aware, SDC humanitarian aid views protection as being absolutely central to every humanitarian activity, as reflected by our own internal operational concept on protection and our strong support to protection efforts in various sectors. Over the past few years, SDC has been providing financial as well as technical support through the secondment of several experts from the Swiss Humanitarian Aid Unit to the GPC, the Child Protection Area of Responsibility, the GBV Area of Responsibility, and other multilateral and bilateral partners at HQ and field levels. At the global level, among other examples, we've provided support for the development of the UNHCR policy on IDPs. We've also provided support for the establishment of child protection regional help desks in Arabic, Spanish, French, and English. Also for trainings for standby partners on child protection coordination and caseload management. And we've also been engaged in the development of the global partnership to end violence against children. At the field level, we've supported almost 400 bilateral protection projects with a total of 200 million Swiss francs over the last 3 years. Since I was referring to food security, Switzerland has also taken a leading role in promoting protection within WFP and raising awareness among member states. Recently, we've supported the implementation of the new WFP protection strategy and the development of a new protection policy. We've also deployed about 18 protection experts to WFP, mainly at field level since 2010. So to conclude, SDC encourages stronger collaboration and complementary approaches between the different clusters, both at country and global levels, in order to achieve meaningful collective outcomes for affected communities. In particular, we would like to commend the Child Protection Area of Responsibility and WFP for their current efforts in CAR, DRC, Mali, and South Sudan to reinforce synergies between child protection and food security. SDC is keen to see humanitarian partners expand such integrated approaches in further contexts, wherever possible and relevant, in order to break the silos between clusters. SDC itself is currently seeking ways to better integrate protection and GBV risk reduction across its interventions. This session provides you with the opportunity to illustrate some of the experiences and lessons learned of the GPC, the Global Health and Food Security clusters, WFP and UNICEF, in working collectively and adopting integrated approaches in responding to protection risks. So just to conclude, I encourage you all to contribute with your ideas and thoughts to the discussion this afternoon. Thank you very much for your time.
Charles, thanks so much to you. Thanks for SDC for the support and for those encouraging words around stronger coordination. And indeed, colleagues, that's something we're going to be asking you about. What support later on, what support do you need for that stronger coordination that Charles was referring to, but also what are those examples? So if you can prepare yourself to share some of those examples around good practices. Thanks, Charles. With that, I wanted to ask Linda, if you're online, if you could come in and say a few words about health and protection. There's been so much going on. There's always a lot going on, but there's been so much going on, particularly over the last period in relation to health and protection. If you could say a few words, if you're there. Highland.
Hi, everybody, and thanks very much for the invitation to this discussion. I'm just going to share with you a few slides just to kind of shape what I'm about to say. I mean, I think as has already been indicated, it's long been recognised both at global and country level, the need and the benefits of both health and protection to work more collaboratively together. And we know quite a lot of action has taken place, but we haven't really understood it in a particularly systematic way. And we've often found it difficult to kind of frame what it is we actually mean by better synergy and integration of our work. So at a global level over the last kind of year, possibly year and a half, time seems to fly, we agreed that we would work collaboratively to come up with what we're calling a joint operational framework. The kind of zero draft of which was shared with country colleagues a couple of months ago, just to kind of get a feel of it and also to get your feedback on it. But the premise of having the framework was really to say, okay, how are we framing ourselves, our action at a kind of principles level, and then how do we take this forward practically? So what we all know, but are reiterating, is that health is a fundamental human right. The concept of every individual, regardless of status, being able to have the highest attainable standard of health, be that physical, mental, or social well-being. As we know as well, protection is absolutely central as a fundamental part of any humanitarian and public health response. So the interesting part is, what is the interface between health and protection? And for us, this really sits around the concept of quality healthcare. Next slide, please. Can somebody pull up the next slide? Great. So we've kind of framed the thinking around health around the concept of quality of healthcare in humanitarian settings. And as you'll see there, there's sort of domains around these central, the purple dots are basically the domains of that basically define quality. Now, many of those have already been actually articulated by the people introducing this session, but it'll be familiar to you within, regardless of which sector you're in, whether it's health protection or indeed food security. But importantly, these domains and the whole concept of quality of care sits within these broader kind of links or principles of humanitarian health response. And you'll see in the bottom line there that the centrality of protection is absolutely fundamental to that. The principles of ethics, patients' rights, humanitarian principles, and accountability of the affected population. So quality is fundamental to what we do. But what do some of these domains mean? Well, obviously people-centered, that our response both in health and then in protection is that our response is based on need, people's preferences and their values, rather than being predetermined by somebody's sort of predefined category. That any healthcare is equitable and both access to and provision of services is achieved regardless of, or offered regardless of any non-discrimination. That health services are timely. In our context, that often means ensuring that access is as immediate as it can be to core services. The issue of reducing waiting times, and particularly in issues around emergency care, or those of you who are dealing with mine victims and others, that there is immediate access to health services. Now, what we're seeing obviously in the context of COVID, that this is stretching us even further to become creative about how we ensure timely access. And regardless of the context that we're in, this needs to be thought about. That we're efficient in the use of our resources, that we maximize the benefit that both protection actors and health actors have, and to use those assets to the best ability. So how can we ensure that our protection colleagues are promoting health, both in terms of health messages or facilitating access to services, and similarly how we as health actors can be promoting key protection messages. Safety and the concept of avoiding harm, doing no harm to the people that we're supporting, not only in terms of the actual health interventions themselves, but as was already alluded to by Charles, ensuring that an individual's access to health services and that the health service providers themselves are safe and attacks are either prevented or the impact of attacks mitigated. That we integrate our response, so both across sectors by all providers, that this should be achieved as well across all levels of health service, and that effective health response means being evidence-based and ensuring that any services are given to those most in need. So this is the framework that we're working in. So in some ways, we almost don't need to question ourselves what we do, but it's really using this framework and the principles, the underlying principles from it to really remind ourselves what it is we're trying to achieve, both in terms of quality of care and how both health and protection actors can support each other in doing that. Next slide, please. So to make this practical, because we're all very good at talking theory, but it's really about keeping this practical and ensuring how provision of healthcare can achieve both health and protection outcomes and address the needs of mutually interested population groups such as women, children, older people, people with disabilities, GBV survivors, and people suffering with or living with mental health conditions, etc. So to keep it practical, what we've done is focus the framework around the kind of 6 core functions of the cluster. Whether we like it or not, those are the 6 core functions that we kind of deal with. And we've tried to articulate within the framework suggested ways of how we should be coming together, both to have conversations around these particular core functions, and also give indications of some of the existing tools or guidance or ways of working that can improve an integrated approach. So in terms of support to service delivery, key things that came up in our discussions with when we were developing the framework were really issues around having better understanding and more coherent, harmonized approach to things like referral pathways, standard operating procedures on certain forms of service delivery, that when we're mapping services, that's done from a multi-sectoral, through a multi-sectoral lens, that we can improve access to key services. So for particularly things like survivors of explosive ordnance, or GBV survivors, or people living with mental health and requiring mental health services and psychosocial care. Now we have examples of those. There are many of them across many of the contexts that we work in, but what we need to do is kind of learn from those examples, document and look at the existing tools and processes that we're using and how they can be further improved. How we inform the humanitarian country team and the whole development of sort of strategy particularly focuses on the need of providing effective evidence, and particularly that joint sectoral assessments, data collection and information collection. So the concepts again of both how we best utilize the protection analysis and the public health situational analysis that we mutually undertake. How do we bring that information together to further improve our identification of at-risk groups, how we prioritize those within the inevitable challenge of having to be able to decide who is most in need and gets services, how we better target our interventions. And some of the, just to say, I think it was interesting when we put the protocol, put the framework together, that just even learning to understand each other's language around what we mean by our mutual analysis process was quite interesting. And then looking at how those information sharing protocols can help the movement and access to information from which we can mutually make decisions on service allocation and need. Again, on joint planning and strategy development, the 3rd core function, we can see already within the HNO HRP process that more emphasis is being put on this joint action, joint analysis, and then the forming of common priorities and collective outcomes between our two clusters. So what have we learned from that to date, and how can we further improve that? And also, how can we identify those common priorities between health and protection, not only within the HRP, but also within the HCT protection strategy, so that this is really seen as a global and country commitment to driving this dual action forward. In terms of monitoring and evaluation, well, inevitably we all have our various approaches to that. There is general agreement that we should be more systematic through the development of joint M&E frameworks, common indicators, and more standardized approaches to monitoring. And that we build capacity amongst our various actors, both within the coordinators and the coordinating teams ourselves, but also our partners, to have a greater understanding of the roles and responsibilities in respect of the other sectors. And to ensure that through that understanding, for example, that protection mainstreaming occurs in all health cluster preparedness response activities, and that health cluster teams and actors are much more open-minded and cognizant of the need to take that into their thinking when developing their response strategy. And then finally, the concept of, or the core function of advocacy, which I would be inclined to say has probably been our strongest element, because there's, it's often very immediate, often very visible, particularly around issues of attacks on healthcare, and the action being taken in a number of countries to have a more coordinated approach to that, both in terms of strategy and messaging. And we have a number of examples of where advocacy working groups have been created, for example, in Mali, Libya, OPT, and others, where the groups have come together around quite substantial issues and had strong messaging and strategic engagement with key partners, both national authorities, donors, and others, to address particular issues. I think, again, what we're seeing, particularly in the relation to COVID, I mean, again, it's not COVID specific, but being accentuated by COVID, is the issues around risk communication and community engagement, and how that pillar of the response, the bringing protection into that group to really augment not only messages around the health side of COVID, but also the implications that has and then the potential negative effect it has on certain vulnerable groups and how those effects can be mitigated. So we see many opportunities already existing. As I said, we need to document them a bit more carefully, examine them in a bit more detail, and look at what existing current tools and processes are working, and if there are new innovations out there that we should be sharing. Next slide, please. So a couple of useful references for colleagues. The second revision of the Health Cluster Guide was literally just launched a couple of weeks ago, and you'll see throughout that guide a strong recognition of and some practical guidance on how and examples of how health and protection should be aligning with each other. And similarly, I'd encourage people who are interested to look at the broader document, this position paper that we have on quality of care in humanitarian settings, which again, as I said in the second slide, kind of shapes the common overarching domains and principles that protection and health can use to work more strongly together. Thank you.
Linda, thanks so much. Really helpful, and taking us through the framework that's being developed, and maybe just a couple of references on that, or by way of example. So Linda was talking about service delivery, quality of care, efficiency, so ensuring that we're adding value in our work together. So two examples there that are happening within the protection cluster and work with health, and one is our collective work across the Mine Action AOR, Child Protection AOR, on how we engage with health actors on victim assistance, case management. So how we include that into our standard operating procedures that Linda was also mentioning. The other one is on mental health and psychosocial support, as Charles pointed out, so multi-sectoral work. So again, within the protection cluster, and speaking specifically about child protection, how do we work across those different levels of the famous MHPSS pyramid, recognizing that there may be gaps, for example, at level 3. So health actors frequently working at level 4, and often child protection at level 2, and gaps at level 3. So how do we come together and coordinate with those technical working groups at country level under the IASC reference group to figure out who's doing what, roles, responsibilities, SOPs, and that's throughout the program cycle, from identification to planning and resource mobilization. So I know there are colleagues on the call involved in those areas. So when we come to those good examples, I may call on you there. Linda, thanks so much. I'm going to keep us with the health theme before we go to food security, and we'll go to David Lay, who's the health cluster coordinator in Afghanistan. David, if you're there, if you could share with us your views from Afghanistan. Over to you, David.
Thank you, Michael, and also thank you, Linda, for asking the representation of Afghanistan. So greeting from Kabul. I think as Linda have said, you know, Afghanistan is such a complex emergencies where we actually had multiple, I could actually give you multiple examples in terms of collaborations between health and protections, including the issues of attack on healthcare and the work we've been doing on MHPSS. However, I think when we're talking about health in the last year, really can't really get away from talking about COVID. So I think what I'd like to show the group is the work that we've been doing on risk communications and community engagement, and how the connections between health actors and protection actors to address some of these issues. I think if COVID has taught us anything, that it demonstrates that, you know, not only just risk communication, but also community engagement must be central to the emergency health response. Not only is it the right thing to do, but it also leads to the effectiveness of the health response.
David, I'll just ask, I think it's Anna, if you could go on mute. Thanks so much, David.
Sorry, so as much as, I mean, I think initially in Afghanistan during the COVID response, we were focusing a lot on disseminating the right informations. What we do find is community feedback monitoring is central to effectively engaging the community, and that's where our link between health and protection comes in. Now, I think what we have initially done is that we've recognized there's a lot of stigmatizations and rumors going on that is leading to a lot of misinformations about COVID. So from the health perspective, we can obviously provide the technical background, but we engage with a lot of the protection actors to see how we can actually engage with religious leaders, community leaders, on looking at stigmatizations from people arriving from Iran, as they were always the one that are blamed for bringing COVID into Afghanistan. So we've done a lot of work on stigma around access to hospitals, access discriminations against Iran returnees in the Western side as well. I think these kind of initial work really lead us to think that we do need to take this a little bit forward in order to effectively deliver these communications to where it is necessary. I think part of what we've done is to look at the way that community receive information, and that's also through a lot with protection actors as well too, and find that there are specific ways that certain populations like to receive the information, particularly women's and children's, where perhaps they are not, the traditional social medias or billboards will not get to them. Also perhaps the disabled, the returnees, the IDPs, the way that they receive information are not necessarily through mass medias, and that we are looking at targeting communications to these vulnerable groups. We established the RCCE working group in Afghanistan quite early in March. It's led by WHO and co-chaired by NRC, which is the NGO co-lead for the protection cluster. And what we wanted to do is to really focus on improving community engagement beyond the information provisions. So we're committing to resourcing the member organizations, who in turn resource the field teams to work who works with the communities, and in order to bring in the right informations in the right channels, in the right manners, to those people who needs to listen to them. Now we also look at a collective approach strategies, looking at the 3 pillars of coordinations, assessment, analysis, and informations and communications, as well as the interagency entity that bridges the health and protection clusters. I think this innovative partnerships between WHO and NRC, I think broadly between health and protection actors, were picked up by the Interagency Standing Committee, IASC, and we were fortunately the only countries where WHO and protection actors have partnered it to address the RCCE issues in the COVID response. I think what we have learned is that by utilizing community-based protection network to reach the most vulnerable populations, really is able to deliver messages more effectively, as opposed to the more traditional mass media messages. Now, going forward, we are going to hopefully able to leverage what we've learned from the COVID response, continue looking at community perception trackings, to understand the community view about viruses and how to respond, but also looking at to expand what we learn with COVID and leverage what we know to facilitate health response beyond COVID. Looking at how ongoing health and protection collaborations can be mechanisms of accountabilities. So we, instead of looking at RCCE, we're actually going beyond and looking at what we call CEA, is the community engagement and accountability mechanisms. And that we can see foreseeably look at just beyond COVID, looking at uptake of vaccinations, uptake of reproductive health, institutional deliveries, and some of the challenges that we face in Afghanistan that's been ongoing, but actually able to recognize in a much more community-based areas how we can better address these issues. So I'll leave it here for now. So back to you, Michael.
David, thanks so much. Super interesting, and the points about what we've been able to do during COVID and taking some of that forward, particularly around the community engagement and adapting for groups who might normally be accessing different communication strategies and of particular risk in terms of protection, women and children. Super interesting. Thank you. It's really helpful. Colleagues, we've got another speaker, and just before introducing, we've heard about health and protection. I just wanted to say a few words as we're introducing the next section around food security and protection, in particular food security and child protection. And when I started today, I mentioned the IASC messages, advocacy messages on protection that reference the need for protection to be central to the food security response to COVID-19. And some of you may have seen the snapshot produced by the Global Protection Cluster, the last one, which referred, for example, to significant increases in child marriage, which we've heard about, gender-based violence. Due to COVID-19, those issues are there, but they've been exacerbated. Also child recruitment, so recruitment of children to armed forces and groups. And so we know that we have approaches to prevent and respond to these kinds of issues. One of the key questions is, are we bringing together our different dimensions of work? So on the one hand, recognizing that food security or food insecurity may be a driver, as Charles has pointed out, what are labeled as harmful coping strategies. But on the other hand, there are social norms at play. So, for example, in relation to child marriage and sometimes to child recruitment as well. So, do we respond in a way that recognizes this interplay? Do we use the information from food security to understand what's going on, the locations and the types of child protection issues? Certainly something that we've been championing in the child protection AOR. Again, the Child's Reference work with WFP and the food security cluster to make use of their footprint and data collection. So a lot happening between child protection and food security, critical at the moment. So I wanted to introduce Elspeth Chapman, who is working with a group across food security and child protection, to tell us about the work of that reference group, what they've been doing, their plans for the future, what they've been seeing. So with that, over to Elspeth from Plan Spain. Elspeth, over to you.
Thank you so much for the introduction. So my name is Elspeth and I'm with Plan International in Spain, and I'm going just to present to you the case study of the Child Protection and Food Security Reference Group. So I'll provide a little bit of background, the rationale behind the group and our objectives, some of the country and global level work that's being done to date, and then a couple of reflections going forward. So in terms of the background, the Child Protection and Food Security Reference Group was formed in 2018 and is a joint endeavour encompassing food security and child protection actors. So it includes the Child Protection AOR, the Global Food Security Cluster, the World Food Programme, UNICEF, and from the INGO side, Plan International, Save the Children, War Child, and most recently the IRC. Oh, can you hear me okay now? Can someone just let me know? I can see a couple of comments in the side. All right, yes. Sorry about that. Now. Okay, perfect. Okay, so as you can see, we have a membership of the reference group, including key food security and child protection actors. And the rationale, I think I could summarize as being twofold. Firstly, we know, as Michael mentioned, there are major linkages between child protection and food insecurity, and we know that we need to understand these better. In many contexts, we see child protection risks directly stemming from food insecurity. For example, in 2016, in the El Nino-induced food insecurity in Southern Africa, a child protection needs assessment was conducted across multiple countries and clearly found increase in child labor, early marriage, sexual exploitation, children being separated from their families as caregivers, or children themselves were leaving home to find work. And as previously mentioned, there are clear and worrying linkages between COVID-19, food security, and child protection. So this work stream and the collaboration it represents is now more important than ever. And then secondly, regarding the rationale, we know that ensuring systematic, targeted, and enhanced child protection integration can mitigate food security programming in exacerbating or creating child protection risks. And we know that with joint analysis tools and collaboration between child protection and food security actors, we actually have the potential to better contribute to protection outcomes. So to summarize, as a group, we recognize there are significant benefits stemming from enhanced collaboration. And especially now, given the global context, especially with COVID, there are major and growing needs. So looking a bit at our objectives, essentially, we joined forces to form this reference group in order to put more resourcing, analysis, and solutions for integrated approaches across child protection and food security. So specifically, we work together to strengthen knowledge management of best practices, to generate the evidence needed to capture specific linkages between child protection and food security, and ultimately to build a solid foundation for better collective outcomes. So this can help inform the development of protection responses to child protection and food insecurity, either through complementary programming or, where possible, through joint initiatives. And ultimately, we aim to equip actors on the ground with the tools and resources to do this as part of their day-to-day work in designing, implementing, and monitoring programming. So what are we currently doing? At a country level, the reference group has carried out activities in CAR and DRC, Mali, and South Sudan, and expects to expand to further countries. And much of this focus to date has been on data collection and analysis. So, for example, in Mali in 2018, child protection was integrated into the VAM, into the WFC Vulnerability Assessment Mapping Indicators and Analysis. So this was done through key questions being incorporated into the National Food Security and Nutrition Survey. For example, questions were added related to child marriage, and in the section on livelihood coping strategies, we were able to include sub-questions to capture if children were also taking part in these mechanisms. And this resulted in a publication of a case study on understanding child protection and food security linkages. A similar exercise was conducted in CAR in 2019, which has led to a child protection analysis of food security, which is pending final release by WFP, and we hope to share this as soon as we have the final version. And similar activities are undertaken in DRC. So I think the learnings from this is a next phase to deepen this integrated data collection analysis. And this was very much one of the key recommendations coming out of the CAR child protection analysis, is to enhance the qualitative data collection and the participation of children and adolescents in these processes. For example, through conducting focus group discussions and/or key informant interviews with child-headed households and separated and unaccompanied minors. So to do so, we would need to push for further collaboration on the ground, because as we know, it's food security, livelihood actors typically leading these data collection assessment processes. So in order to ensure that there's meaning and ethical participation of children and adolescents, it would require further consultation and close work with child protection working group and relevant actors on the ground. So this is something that as a reference group we're discussing now, and we can hopefully take forward in next phases of data collection and analysis. At a global level, we've started working on some draft of an advocacy document on integrating child protection and food security, looking at case studies from Somalia, Kenya, and South Sudan. And in 2019, we led an internal session to WFP HQ and country office protection staff on child protection and food security integration. And we also presented some of our work at the Program Quality Working Group of the Global Food Security Cluster. So this was to raise awareness of the reference group, some of the integrated approaches in child protection and food security, and also to gain their feedback on some country pilots and support moving ahead. So the final point is just a quick reflection on where we're going now as a reference group. And I'm just going to touch upon this very briefly, as I think in the plenary, we would love to gain your inputs on how we can better support integration. But we know that while field level collaboration between child protection and food security actors is increasing, as a reference group, I think now we really recognize the need to create a more formal operational framework to structure and institutionalize the collaboration and ensure that it becomes a core part of our day-to-day work. So a core part of child protection and food security response at a global level. So we hope to continue to improve and expand research upon understanding how food security is a driver of child protection. And then we also want to use this evidence to develop guidance and tools to support child protection actors on the ground. So for example, this could be a guidance to improve food security actors' capacity to safely and meaningfully consult and engage children, as I just discussed briefly, when conducting food security assessments. It could be, for example, targeted training for food security field workers on the specific child protection risks associated with different food security instruments and how to mitigate and respond to them in their project design implementation, and then equipping them with the tools and methodologies to do this. So that's just an overview of the reference group in a snapshot. And Michael, if you want to add anything there or I've missed any elements, please do. We will include our contact details for the reference group if you have any more questions or you want to reach out to us bilaterally in the follow-up communication. So thank you very much.
Elspeth, thanks so much. And yeah, super to hear about the cooperation with food security and WFP and colleagues. to get a better understanding of the situation to inform integrated approaches. I'm wondering, David, if you're still with us. We've got a number of questions already in the chat box specifically for you. Are you there, David? And if not, we can come back to those. Colleagues, thanks so much for using the chat box. We've got Christelle asking about the RCCE in Afghanistan. How do they select risks, for example? We've also got a question, Joyce coming with some examples from Northeast Nigeria around working child protection health workers on child protection, IASC materials as well on healthcare. And Samia coming in with a question. It would be good to hear about protection-related results from health and protection in Afghanistan, how they're being measured. So when we've got David back, we'll come to him. Colleagues, we've got a brief break, just 5 minutes, and then we've got some questions for you, including from STC, from Charles, a question from Aldona to you. So we'll take 5 minutes, if I'm right, Yasmin, and we'll come back at the top of the hour. It's 55, so that will be 3 o'clock in Geneva and whatever that is where you are. Yasmin, I hope I've got that right. We'll come back together in 5 minutes.
Yes, you're right.
Okay, good. Good. It's nice. We're on time. Colleagues, thanks. Grab your tea, your coffee, think about your good examples, and we'll also be asking you some questions. See you soon. Yasmin, I was also going to ask if you have some music to play. That would be nice. Go ahead if you do.
Sorry, Michael, you couldn't hear the song?
No, I can't. I'd love to.
Okay. Okay, trying again.
Yasmin, thanks for the music. That was great. We should do that every webinar we have, and let's do it again before the evaluation. Maybe it will help too. Colleagues, thanks for coming back, staying with us. We've got a question, and Sophia was saying that's the best music so far across all of the GPC sessions. There's been some good music. Thanks. Samia coming in and saying thanks. Colleagues, I hope you're able to read the chat box, but in case you're not, I wanted to go to Charles. If you can also ask the question to colleagues. Over to you, Charles.
Yes, thanks. Thanks, Michael. No, I would be interested to hear from participants what level of engagement you have with donors at field level regarding increased collaboration across clusters, and specifically between the protection cluster and the food and health clusters. If you have any specific support or any specific experience with donors, we would be interested to hear them. Thanks.
Thanks, John. So I don't know if anyone wants to come in specifically to that question. What's your current level of engagement with donors? Are you getting support? Are they supporting the kinds of approaches that we've heard about and that we're being encouraged to get involved in? So do jump in either on the chat box or in person. Would anyone like to go ahead?
Hi, it's Linda.
Linda, go ahead.
Look, I don't have specifics. I mean, it's not something that we've mapped across all our clusters. I think, as I'm sure Charles knows, I think the dialogue at country level and the encouragement to integrate activities is clearly a stronger conversation than there's been in the past. To what extent that is, but often that is around the issue of joint analysis, I think, and of course it often comes up around the issue around the HNO and the discussions pre-HNO. So the conversation is there. To what extent they're actually being funded, frankly, we would have to go and do some sort of mapping of that. So yeah, not terribly well understood, but we could certainly find out. Thanks.
Yeah, thanks, Linda. That's a good follow-up question, isn't it? Is it a positive discussion? Is it a case of integrated approaches being put forward and funded, or that we're not putting forward those approaches? That would be, yeah, that would be very good to know. I don't know, Charles, if you've got thoughts on that yourself, or if others would like to come in. Charles, are you there?
Yeah, sorry, I was on mute. Yes, no further or no particular thoughts. I mean, it's not exactly my area of expertise. So maybe my question was a bit too naive, but no, I'm just wondering to what extent this is a topic, part of the humanitarian country teams discussions, and to what extent the humanitarian coordinators are insisting on better collaboration across clusters. I was not specifically referring to financial support, but maybe even technical support to help to help cluster leads better work together, sort of.
Yeah, yeah, and I guess on that, it's a package, isn't it? It's the encouragement, it's the technical assistance, it's the resources. Is it part of the discussion at HCT level, as you're saying? So super interesting to try and find out more. Because on the one hand, we are getting the messaging. We need to work together. As Linda's saying, are we doing analysis together? Are we getting that encouragement and engagement? Are there resources for that? I mean, I think super interesting. Colleagues, use the chat box if you've got thoughts on that around the donor engagement. While you're doing that, hopefully you can see the screen. And if you can, and I hope you can, you'll see a Slido question. We've got a question for you. And if you don't know how to go through Slido, you simply type in slido.com and you'll see the number for the question, and that's 63058. And then you start answering the question. And the question is the following: operational integrated approaches across sectors, which kind of support would you require at the field level? So the question is, what sort of support do you need at the country level or at the field level? And Dalia, I'll just ask you to go on mute. We're hearing you coming in if you can. What sort of support do you need at the field level to make that happen? So that work across sectors to be integrated. And we'll see those responses starting to come in. So you'll see, if you can see the screen, slido.com, and then you start putting in your answers. And we've already got some answers coming in. So coordination support, it would be good to know even more what kind of coordination support. Analysis, so doing analysis, designing proxy indicators for use from each other's assessments. Interesting. So coming up with indicators that can be used from each other's assessment. We'll just take a minute and see what comes in from you. So we've got colleagues saying funding to address the root causes. So resources that are actually addressing what's common to all of us, which are those root causes. We've got analysis of joint results frameworks. Right, so technical support for integration, interesting. So we often see lots of guidance around integration, and as Linda was saying, we've got lots of material at the global level. How do we apply it? So technical support for integrated approaches, information sharing. So more information sharing, I guess more predictable and frequent information sharing. So we'll just read through some of those. We've got funds to address the root causes, capacity to do joint evaluations, and technical guidance that's easy to implement and easy for partners to understand. Super important, given so many of our partners are local as well. Funds to address the root causes. Mutual training, so learning together, super valuable, even within protection, but definitely with other sectors as well. And understanding those roles and responsibilities. Great. So feel free to continue inputting. That's really helpful. And while that's been happening, we've had some examples from Joyce in Nigeria about donor engagement. Joyce, I don't know if you want to jump in and give us that, speak to that example, and also asking others to come in. We heard from Linda about, do we document and catch these good examples of practice around donor engagement, but more broadly. So Joyce, are you able to hear us? Do you want to jump in and get us started?
Good morning, good afternoon, good evening, everybody. Good afternoon, Michael. Thank you. Just confirm you can hear me?
Loud and clear.
Thank you. I just shared an example of a project that's being run by IRC in Northeast Nigeria. And when IRC was developing this project, one of the discussions that we had was about how we can improve referral and access to services for vulnerable children and families when they have been identified by child protection caseworkers. What we found very difficult was for children to get support services, especially related to health. And we also had concerns relating to livelihoods for the caregivers. So we thought that one of the ways that we could look to improve this was to see whether partners could actually develop projects that allow for what I would call internal referral within their own organizations, which makes it easier, cuts down on costs for referral and so forth. So we're already seeing very positive results, especially for child protection and nutrition, in terms of vulnerable children being referred by the nutrition actors within IRC, as well as vulnerable children being referred for PSS and other protection services by the nutrition staff, and then the CP staff in IRC providing the requisite support in terms of PSS, in terms of case management. So the internal referral is what we see as a good model that can be used. Obviously, not all agencies have the capacity to work across different sectors, but for those agencies that are able to do this, I think this has been a good example, and that has been very welcome for donors, because then they work with fewer partners, but see greater impact and service delivery for children. I hope that's been clear. Thanks, Michael.
Great, thanks, Joyce. Really good example. Thanks so much. And again, yeah, how do we collect those good practices and examples so that they can be shared? We become more systematic. I'm going to go back up the chat box a little bit, and we've got Murat, who's working with us across Humanitarian Action, child protection, health from ProCap. And Murat, you were speaking specifically to Afghanistan. Are you able to hear, and did you want to come in with your example, but I think also a question?
Yeah, thanks, Michael, and hello, everyone. Thank you for that. No, it was, I mean, I did pose the question to Afghanistan simply because I think it's great that we had to hear from David today, but I think that same question could go for any operation where the issue of child victims vis-a-vis explosive ordnance, especially in contaminated contexts, is of concern. So my question was that I heard what I heard from Linda around the core functions and the collaboration that is required around information and data, integration into HNOs, joint response planning, indicators, and common M&E frameworks. For me, that was very encouraging to hear. But from the from some of the reviews that had been done previously, we found that often in the HRPs or HNOs, we don't find dedicated indicators on the HRP side or dedicated budgeting that might address some of these crossover issues, such as child victims who are in need of health interventions, whether it's first aid, surgery, or longer term physical rehabilitation, MHPSS, or assistive devices, prosthetics, orthotics, so very much in the realm of health, and then and not being able then to have oversight in terms of the reporting. So yeah, I think Afghanistan is a good example, given the issue of child victims, as far as we see at the global level, is a very important one and has been for a number of years now. So was in fact wondering on the planning to integrate some of those dedicated cross-sectoral indicator across the protection and health, and if dedicated resource requirements are going to be articulated there. At the GS, that could go for any operation, so or just Afghanistan. But thank you very much, and back over to you.
Thanks, Murat, and also a great question in terms of the resources. How are they being configured for those integrated or collective outcomes? It's excellent. And I'm seeing Inna. Good to hear from you in Nepal. If you'd like to come in with your example, if you can hear us, over to you. Inna, can you hear us? While we're waiting for Inna, I think we've got colleagues in Libya who wanted to come in. If you can hear us, please go ahead.
Yeah, hi, can you hear me?
I can. Go ahead. Is it
Great.
Yeah,
this is Anne-Marie from the Libya protection sector. And we wanted to give some examples on the cross-cutting work that we've been doing with the health sector in particular over the past probably 6 months since COVID started. One of the first initiatives that we were able to do was actually to write advocacy guidance. And so I know I've seen a bit about advocacy to donors, which is not really what we were talking about in this example. We were actually doing advocacy on some joint protection and health concerns that we presented then to the HCT, who are also able then to present that on to the authorities, which included sort of release from detention, concerns about equitable access to services for particularly marginalized groups. In this instance, we were thinking refugees and migrants. And I haven't seen a lot talked about advocacy, but this was one of the core things that we actually was the very first thing we jumped on, was how can we do joint advocacy as a health sector, a protection sector, and then also our standing advocacy group, which is the Migrant and Refugee Platform. And then from that, when we started sort of this, I guess, partnership and working closely with the health sector, we also recognized that there was a need to mobilize resources to get a mental health and psychosocial support technical working group up and running. And we were able to work with our NGO and UN partners to find sort of the, I guess, incentive to really get buy-in for that technical working group in. And that was definitely an initiative that was duly spearheaded by both the protection sector and the health sector. So I guess advocacy, both on the note of sort of protection and health issues, but then also advocacy, as we were talking about earlier, with donor engagement to make sure that technical working group would be staffed and have that sort of support and funding as well. Over.
got from Christelle. Christelle, would you like to come in about the application of the framework? And while you're getting ready, we've also got a question about why only child victims in relation to protection and health. And as Linda can point out, that framework agreement is across all of the protection clusters. So indeed, looking at the many aspects, not only in relation to children. Christelle, are you there? Would you like to go ahead with your thought question?
Sure. Would you like to allow me to use my video, or you'd rather not?
Go ahead, please.
Okay, thank you. Can you hear me?
Yes.
Great. Okay, I just cannot start my video because the host has stopped it, but that's okay. I'm very excited to hear this conversation. It really makes me realize how important both food security and health cluster are to the protection agenda and to the mine action agenda as well, and how really we should invest more in collaborating with them. I was working with the colleagues who developed with Linda the joint operational framework for the health protection collaboration. I think we have a very practical way forward. To the question raised by Mr. Apotheker, I don't think we have yet put in place a plan to implement this collaboration framework. And indeed, it would be useful to have, some resources, a little support cell to, I think, drive the implementation going forward and support the field in implementing it. From the mine action perspective, what I'm really interested in is being able to share information about the explosive ordnance risk with our health coordinators in the field, so they can look at what is the health capacity they have in the regions that are the most, at risk, vulnerable, based on our analysis, and fill the gaps, plug the gaps, because they're really remote areas where, in order to access a clinic or an emergency health point, it's 2 hours drive, and by the time they arrive, it's too late. And people have bled to death. So for me, this is a very important collaboration, which is really about saving life. And I'm particularly interested in Switzerland's leadership on this, given that right now Switzerland has the presidency of the Cluster Munition Convention. So I just wanted to say that. In terms of food security, we haven't yet invested very much in collaborating with the food security clusters, just because we didn't have the capacity and it takes time to engage. However, we would be very excited to do it because we can clear land and therefore put land back into farmers' hands, so possibly provide livelihood and food security, which will down the line protect children. So this is why there's a lot of solutions, and I just want to hear more from colleagues as to whether this is already happening. And in places like Afghanistan, Nigeria, Burkina Faso, we should really be piloting that and driving that through our humanitarian needs overview and humanitarian response plans for 2021 and beyond. I was the one who put the comment, and that will be my last point, about the fact that we often don't have money to address root cause, and the lack of health infrastructures in some areas, or the lack of access to education for children in some areas. These are all problems related to the lack of development and infrastructures, because we live in this protracted conflict, or we function now in this situation, and development actors are still quite timid as to investing, making the right investment that could address some of the root causes of these problems. And here I link to the event we had last week about the nexus and how important it is for the humanitarian and development and also peace actors to work more closely on geographic areas and problem solving in those areas. But we need more than, the standard or regular institutional partners. We also need probably the private sectors and networks that are outside the community we've been working on. And of course, working with local solutions and the population and putting them at the center of the decision-making process. So anyway, I think this is a fabulous event, and I thank everybody who's sharing their experience and views on how we can get better in that area. Thank you.
Great, thanks, Christelle. Yeah, the follow through on the framework, back to how do we make it happen, document the practice, and yeah, some interesting thoughts here around the links, Mind Action, food insecurity, connections. Charles, you were referenced there, not wanting to put you on the spot, but if you'd like to come in, over to you.
Sure, merci Christelle. Yeah, just on food security and Mind Action, if I'm not mistaken, I think the current draft, the new, the latest draft of the new WFP protection policy briefly refers to Mind Action. And I think it would be interesting maybe for you, if you haven't had the opportunity to get in touch with the protection unit of WFP in Rome, I would be happy to share the contact details in that regard. We are in regular contact with Anne-Laure Duval and her team. So I think there's maybe some further exchanges to have on Mind Action in food security. Over.
Thanks, Charles. Thanks so much. And yeah, we can share those details. And of course, if we've got colleagues from WFP, do jump in as well, but we can share those details. We've got some colleagues from Mali who I'd asked to come in, if you can hear us, and then we're going to go to our next Slido exercise. Colleagues from Mali, please go ahead.
Hi, Michael. This is Marie. Can you hear me?
I can. Hi, Marie. Nice to hear
Hi.
Over to you.
Yeah, I wanted to share the one example of the work that we've been doing with the health cluster in Mali. We have identified through our protection monitoring system an increase of attacks against health centers in the Sahel and in Mali in particular, and threats against medical staff, particularly during the month of August and September. And so we have started a discussion with the health sec cluster how we can better improve and systematize the monitoring of those attacks. So we have several monitoring systems in place in Mali, which are all collecting data and information on those types of attacks. And we wanted to look at how we can systematize the collection of information and then have joint advocacy on those issues. So we do have the protection monitoring system of UNHCR and the protection cluster collecting information on attacks against health infrastructures, but we also have the MRM system on child protection, and then we have the health cluster and WHO who have their own surveillance system for attacks on healthcare. So one of the challenges that we have seen is how to make all those systems work together, and how can we more systematize the information that we are able to collect, and how can we use that for advocacy purpose. So one of the things we are looking into is have an advocacy note next month that we would try to address for the HCT and see if we can come up with some a joint recommendation between the protection cluster and the health cluster. Over.
Thanks, Marie. That's really interesting and a really important point. How do we get those different monitoring systems to talk to each other? Your example on health, and you mentioned MRM, and really interesting because we do think that there may be trends that we could look at, for example, in terms of MRM and food insecurity, for advocacy, early warning. Yeah, really great point. Thank you. And I think we've got some colleagues from Syria who wanted to come in. If you can hear us, over to you. Do jump in.
Hi, hi. This is Samir, the whole of Syria cluster co-lead. I just wanted to share some examples which may not be exclusive to our context. So I apologize if I'm sharing examples that are commonly used by other colleagues as well. But one of the key things that we have managed to do is for the past 3 years, we have done an extensive protection risk analysis training for all sectors, including health and food security. As a result of that, at a whole of Syria level, they have been able to develop their own protection risk analysis matrix, which informs all of their sector projects to incorporate those protection risks and mitigations towards those in each and every one of their HRP projects across the health and food security sectors, similar to all of them, which has obviously resulted in an impact in mitigating the protection risks specifically identified, and we help them in developing this analysis. In some of the hubs, we have also had very close cooperation between health and protection actors through dedicated MHPSS groups, in which they have not only been able to coordinate in order to spread the resources to cover a bigger number of groups, but also to streamline their approaches and incorporate the different sort of case management strategies from each discipline to provide a more comprehensive MHPSS response. And another example was also in relation to protection monitoring and in relation to COVID challenges that we faced. I think recently we needed to do a small monitoring for intention survey in relation to prospective population that was about to be moved from one camp to another. While movement was restricted due to COVID, the health actors had much better access and presence in the communities due to the nature of their activities, which was seen to be far more critical. And we were able to liaise well with them to develop a questionnaire and be able to conduct that survey jointly using our methodology, our questions, and using their partners on the ground in order to then present a wholesome picture of the kind of risks that were being faced by the people who were about to be moved, to then launch advocacy for that. So these are some of the examples that I can share.
Samir, thanks so much. They're great examples. And yeah, looking at the protection risk across all of the sectors, and I know historically the protection cluster in Iraq has also done great work on that. And also the example you've got around using different sectors' footprints, keeping in mind the risks of collecting information. And it links with, I think, what Elspeth was mentioning as well. How do we include into food security assessments specific questions? Really helpful, thank you. And we'll get to how we document and share these really great practices. Often we hear that people are not working together, but it sounds like there is a lot of great work happening. But how do we collect that and make it available? We've got our last Slido activity. We do want to hear from you. This is really important. Not just because you've got really great advice for us, but it's about the nature of this question. And this question is really about how we can help you if you're at the country level. So strategic integrated approaches across sectors. How can the Global Protection Cluster and areas of responsibility keep investing in it? What are some ways we can invest in this to support those activities at country level? So again, you'll see the slido.com. We are going to collect these. They're really valuable for us. We value your opinion. So take a minute. Strategic integrated approaches across sectors. How can the GPC and AORs keep investing in this beyond today? So if you've got thoughts, if you can put those in. Thank you. And just to say, it is anonymous. If you'd like to, as Christelle did, you can name your entry, but yeah, it's anonymous. So any thought is a good thought. Okay, so agreements at the global level with other sectors toward adopting protection indicators. No more guidance, super interesting. So no more guidance, stop the guidance. We heard earlier on support to make integrated approaches happen, not more guidance. Interesting. Resources, be good to know, yeah, kinds of resources, how to get resources for integrated approaches. A little bit as Murat was asking. Inclusion as a core HPC component. That's really interesting. How do we include those integrated approaches as core HPC components? If you're feeling comfortable when we finish, it would be good to hear more from whoever's put that up. It's a really important point. Requirement for pool funding, so that we have integrated approaches, that becomes a requirement for pool funding. Again, it'd be great to hear from colleagues. I'm waiting for someone to write more guidance, and then we can see who's put no more guidance and more guidance. Right, so sufficient funding for dedicated coordinators and co-coordinators to make that work happen, right? So without the people and the right people, we're not going to be able to have those integrated approaches. Thank you. Okay. Keep on making those additions. As we do, I wanted to come back to the group, and I wanted, in the interest of time, to start coming back to our panelists for any additional thoughts. I also want to see if David is back with us, because there have been quite a few references to Afghanistan, if he's there, but also Elspeth.
Sure.
Linda and Charles, yeah, if you've wanted to come back in based on what you've heard so far today. Mm-hmm. So over to you. Elspeth, go ahead.
Absolutely. Can you hear me okay this time? Okay.
We can.
Okay, perfect. So really interesting to see some of the feedback, and I took a screenshot of the first feedback to share with the reference group, because as going forward, these inputs are really useful for us. I can see no more guidance has come up on the second one, so I'd be interested to hear a little bit more about that. And I can also see from the first slide, technical guidance, easy to implement and easy for partners to understand. So I think for us, this is key. And when we think of a reference group as developing guidance, we think of this as having very pragmatic tools. So a post-distribution monitoring template that integrates child protection. So very simple tools that can be used. And again, the focus on easy to implement, I think, is going to be key for us. And then my second point was really just hearing about the examples of integration just goes to show how much there is going on, and we don't need to reinvent the wheel. And it's really important that we better document what's happening and that these are shared. So again, just if anyone wants to reach out to the Food Security and Child Protection Reference Group to either share best practices, to see how you can be involved, to provide us with some kind of needs or your thoughts going forward, then this is most welcome. So thank you.
Thanks, Elspeth. Thanks so much. Charles, if you'd like to come back in, and also to colleagues who've posted there, if you've got follow-up thoughts to what's been posted, please do. Linda, if you're there, if you'd like to come in, or David.
Hi, so David has a visit going on from the regional office from Emro, so he's got, other more important guests than us. So he may come back, but I suggest if he isn't able to come back, then we can send the questions to him and perhaps he can just give us some written responses that we can circulate against the participants if that's useful for you. I mean, again, very useful hearing the feedback. I think I kind of agree with the no more guidance. People want to learn from existing examples, practical examples. And I agree with you, Michael, there's tons of examples out there, but we're just not capturing them. I suppose the question on these examples is, it's good to have the example, but have they made a difference? So I think this is, we all get very excited that we're working together, but to really demonstrate that it is making a benefit in terms of reaching the people we need to reach and mitigating risk, improving outcomes. So how do we do that in some sort of sophisticated or more systematic way? Again, I think the other thing is really comes down to evidence. I think there were a few questions about how to promote or ensure that certain elements are included in HRPs. But we all know what that game is. You have to present the evidence to demonstrate the need and the prioritization for that. I think what we struggle with, particularly in the health sector, I'm sure it's to you guys as well, is that the increasing request to include multiple issues within a package of health services is frankly becoming overburdening. And so it does, of course, demand us to go back and do even better or more diligent prioritization, etc. So I think it's about how are we using our ability to do that joint analysis and present the need as effectively as we should do. And then, of course, funding for that isn't necessarily always going to come through the HRP. We know there are partners who have experience in certain thematic areas related to health and protection that perhaps we should be engaging with in a more strategic way, and how we can capitalize on their expertise. I think also, are we joining up with development actors who may actually be providing these services already, but not necessarily aligned to the humanitarian discussions? So, how do we expand or identify and then further expand the capacity to support some of these service needs that we have? Thanks.
Thanks, Linda. That's really helpful. How do we present the evidence? How do we measure the benefits, right? So we're being encouraged to work together about how do we show that that's, to come back to your earlier presentation, improving quality. How does that improve efficiency? How does that help to deliver collective outcomes? So how do we generate the evidence from that? It sounds like a couple of people have mentioned we do have good practices and we do have some partners investing, some members across the different clusters investing in these integrated approaches. So I wanted to come, as we start to wrap up, to reference something a colleague mentioned, and that is the internal coherence. And I think it was Elspeth mentioned that. Do our organizations, all organizations, have that internal coherence? Because if we're going to be working with other sectors, we also need to look inside, whether we've got that coherence. Before I start, thanks so much, Linda. Before I start wrapping up, I wanted to see if anyone else would like to come in with any thoughts. We've heard about the good practices, the support you might need, the support you don't need, in terms of guidance that's been referenced. Anyone who hasn't had an opportunity to come in with or would like to come back with some examples.
Michael.
The floor is open.
Michael, hi. This is Yassine from Syria. How are you?
Yassine,
well,
please go ahead.
So something in Syria in particular, we realized because there is too much politics around this response. So what we're trying to do within Syria is to push back a little bit the politics around the coordination, and also to bring back a sector as operational, because with the time I have seen also another operation, the sector, there is some kind of lack of trust of the sectors in general, because it's ended one or two person who decide the strategy, write everything with no consultation. So what we have been doing in Syria lately is bringing the power back to the members, to the protection of the humanitarian partners. So instead of Yassine leading on one initiative, writing about health and protection, or WFO food and protection or child protection, so we are selecting an active members in a humanitarian community and tasking them in somehow to lead these initiatives. And our role as a sector is to see how to support them, because in the end of the day, they are the sectors. This is why we start somehow forgetting that the sector is the members, and it's ended with a two-person who decided everything. And this is what we do. We go to specific few members, we see them active, and we convince them, if they already have something in place, we convince them to lead the initiative. And we engage the senior management, the leadership, who are really into this idea, and they like it because they are more operational, they have more resources, they have more expertise, and they are on the ground and who's doing the work. Instead of the coordinator who far away and never been in the field or who have no clue. So this is what we're trying to do, bringing back the power to the members and making them lead the initiative. And our role is how to support them, like in terms of advocacy, discussing with the leadership to give them a space. Unfortunately, we have over a little bit of power over the Syrian Humanitarian Fund. We're also trying to shift this fund toward these initiatives also. Thanks.
Thanks, Yassine. It's really interesting. So finding those members, we're member-based clusters, sectors, finding the members who are already investing, they've got a track record, and how do we help to elevate their good practice, capture their good practice and an example. So it's excellent. I agree, absolutely agree. So we've heard about good work that's happening today, for example, with different members. Yeah, how do we support that? To expand on that, for example. Thank you. Last chance for anyone else who'd like to come in. And Yasmin, if you can load the evaluation. We've got a super quick evaluation. Colleagues, please do complete it. It's really important. We want to improve. So if you could quickly do the evaluation, we'll take a minute. And Yasmin, we'll just take a minute before. Does it come with music? If you have some music, I think it's going to help the evaluation. Murat's saying, I hope you're not saying you'll only do it if there's music on, Murat. I don't think that's what's implied. We could put on music for a minute while we do the evaluation. Okay. Thank you, everyone. I'm just going to say a couple of words to wrap us up. Thanks for doing the evaluation. A few things. We've heard today about good examples over and over again. We're going to share with you details of where you can share those good examples with colleagues who are panelists, but also the different groups that have been mentioned. A quick summary. So we've heard, and Charles, thanks. I know Charles just had to run, but thanks so much for joining. Really interesting discussion, including the donors' engagement, how they might be able to support integrated approaches, and then raising questions about humanitarian country team. Is there encouragement for these integrated approaches? We heard about the support, thank you for that you may need at country level to make these things happen. We've heard specifically about some of the work that's happening from the panelists, and Linda took us through that framework across protection and health is super valuable. We've heard about the child protection and food security group that's working exactly to identify and amplify those good practices. We had a discussion specifically around advocacy, which was interesting. How do we advocate together? How do we engage together around advocacy? For me, coming back to the start of today's session and how critical it is that we work together, recognizing that other sectors are both delivering protection outcomes, helping to reduce risk across in a variety of different ways. So more important now than ever, but how do we get that happening systematically? How do we catch those good examples, amplify them, and then look at the opportunities in our systems and ways that we work for that to be taken forward? I wanted to thank Yasmin for helping us to be organized today, pulling the session together. Thanks so much, Yasmin, from the Global Protection Cluster. Bianca from CPAOR, thank you so much. Boris as well. Thank you to all of the panelists. And most importantly, to you, the participants, thanks for sharing your time, your examples. Do please continue to stay engaged with the work across the sectors and clusters. We'll post the recording on the GPC website with the details of how to follow up, and hopefully we've got your email contacts, so we'll share those with you as well. Big thanks and take care wherever you are. Thank you very much. And have a good rest of the day. Thank you.